respected teachers and dear co-PGTS. Today I am going to present papers on serum leptin adiponectin ratio in patients with and without metabolic syndrome. Metabolic syndrome is a complex disorder with high socio-economic cost that is considered worldwide epidemic, and it is estimated that over 1 billion people in the world are affected with metabolic syndrome. And it is a cluster of interconnected factors that directly increase the risk of coronary artery disease and type 2 diabetes mellitus. The main components of metabolic syndromes are dyslipidemia, hypertension, abdominal obesity, and insulin resistance. Now, the two adipokines secreted by adipose tissue, leptin and adiponectins, are found to be strongly associated with cardiometabolic health or diseases, and leptin by its action regulate appetite, energy balance, body mass, and metabolism. Adiponectin, whereas regulate glucose and lipid homeostasis. And in recent years, LA ratio has been suggested as a possible component of metabolic syndrome. And the aims of our study is to estimate the levels of serum leptin and adiponectin in patients with and without metabolic syndrome, and also to determine the serum leptin adiponectin ratio in patients with and without metabolic syndrome. And this study was conducted in our department in collaboration with medicine department. It is a cross-sectional study. During the period of January 2021 to October 2022, cases include individuals whose age is 30 years and above, diagnosed case of metabolic syndrome as per IDF criteria. In this study, metabolic syndrome is defined according to IDF criteria 2006, which require the presence of waist circumference more than 90 centimeters for male and more than 80 centimeters for female, plus any two of or more of the following factors, like increased triglyceride levels more than 150, decreased serum HDL level less than 40 in male, less than 50 in female, blood pressure more than 130/85, and impaired fasting glucose. And control were taken from age and sex matched healthy individuals. And the patients with type 1 diabetes mellitus, chronic kidney disease, liver disorder, patient with history of cardiovascular disease, immune deficiency or steroid therapy, and pregnant women were excluded from the study. And the sample size was calculated by the following formula, and altogether 100 participants, 50 patients with METs and 50 patients without METs were included in the study. Data were analyzed using IBM SVS version 21, and ethical approval was obtained from Research Ethics Board. Our study results shows that the mean age of the participant was 61 years, and the number of male and female respectively were 23 and 27 respectively. And metabolic syndrome is found to be more common in older age group. And table 1 compares the different biochemical parameters among control and cases. This table shows that the mean level of adiponectin and HDL were significantly lower among the cases as compared to the control. And the mean level of leptin, LA ratio, fasting blood glucose, and triglyceride was significantly higher among the cases. And table 2 shows the Pearson correlation of leptin with parameters of metabolic syndrome. And this table shows that the level of HDL adiponectin were negatively significantly correlated with leptin levels, whereas fasting blood glucose, weight, BMI, waist circumference, blood pressure, and skin fold thickness were significantly correlated positively with leptin's level. And table 3 shows Pearson correlation of adiponectin with metabolic syndrome. Parameters of metabolic syndrome. In this table, we can see that HDL correlates positively with adiponectin level, whereas triglyceride, weight, BMI, waist circumference, blood pressure, and skin fold thickness were correlate significantly negatively with adiponectin level. And table 4 shows Pearson correlations of adiponectin LA ratio with parameters of metabolic syndrome. HDL negatively correlate with LA ratio, whereas weight, BMI, waist circumference, skin fold thickness, blood pressure correlate significantly with LA ratio positively. And ROC curve analysis revealed that LA ratio have the highest area under the curve value of 0.18 for diagnosis of metabolic syndrome, and which is followed by leptin and adiponectin. And in our study, metabolic syndrome is found to be more common in older age group. This may be due to physical frailty, malnutrition, compromised immunity, and chronic diseases. And leptin and LA ratio levels were significantly higher among metabolic syndrome than that of control subjects, and whereas adiponectin level were significantly lower in metabolic syndrome, and leptin significantly correlate positively with BMI, weight, waist circumference, skin fold thickness, and negatively with adiponectin and HDL cholesterol. And increased leptin found in this study among the metabolic syndrome may be due to its direct correlation with adipose tissue mass, and also its resistance to its effect on the target organ. And adiponectin correlate positively with HDL and negatively with leptin and triglyceride, BMI, waist circumference, skin fold thickness, and blood pressure. Decreased level of adiponectin level found in metabolic syndromes may be due to its downregulation by visceral adiposity and the effect of insulin and insulin receptor dysfunction. These are known to suppress the synthesis of adiponectin. LA ratio shows strong positive correlation with BMI, waist circumference, skin fold thickness, and blood pressures, and negative correlation with serum, HDL, and adiponectin levels. And the ROC curve analysis shows that LA ratio has the highest area under the curve value of 0.8 for diagnosis of metabolic syndrome using the cutoff value of 2.65, sensitivity 0.75, and specificity 0.8 as compared to other variables. These findings were consistent with the findings of Ade, Zumo, E.N. et al., etc. And in conclusions, LA ratio can discriminate the risk of metabolic syndrome better than adiponectin or leptin alone. And LA ratio can be used as a potential biomarker for early detection of metabolic syndrome. Therefore, continuous monitoring of LA ratio may be helpful for early detections of high-risk individuals for development of metabolic syndrome. These are my references. Thank you.